I hope you've had a good morning. I know I certainly have, and I've been just blown away by the clinical skills of LT, just in awe of what he accomplishes there. This morning in my remarks, I know we fairly quickly went through all the people that we have to thank, but I want to single out one person. If you haven't met her yet, you probably will by the end of the day, and that is the Executive Director of Presence, Sonu Thadani. Sonu, would you stand up, please? And she and the incredible team that she's marshaled together is responsible for making this flow smoothly. It's my great pleasure now to introduce my dean, Lloyd Minor. Lloyd has been the dean since 2002. Prior to that, he was provost at Johns Hopkins. Prior to that, he was head of the ear, nose, and throat department at Johns Hopkins. He's an accomplished ENT surgeon, very well known for a syndrome that I'm absolutely fascinated by. Patients who come in describing that loud noises give them either dizziness or nystagmus, and Lloyd established that was caused by a weakness of the superior canal in one of the semicircular canals, devised the operation for it. So he's had a really distinguished career as a surgeon, as a scientist, before becoming an administrator. So it's my great pleasure to welcome to the stage Dean Lloyd Minor.
Well, thank you, Abraham. It's certainly a privilege and an honor to be here today. I remember when Abraham first spoke with me and Bob Harrington and others a couple of years ago about the idea for presence. The idea being nothing less than putting humanism back in medicine, bringing back what historically has been the focus of medicine. I mean, if you think about it, it's only been relatively recently, certainly extraordinarily recent in human history, that physicians have really been able to offer much in terms of scientific benefit to patients, really within the past 75 years. Prior to that, the role of the physician was to be a great listener, to be a compassionate compatriot, and when possible, to give informed input and help people work through the complexities of their illnesses and the consequences of their illnesses. Now, we don't want to go back to those days when there was very little that we could offer scientifically. But unfortunately, the growth of the technology and the science of medicine and the way, and we'll talk about this in a moment, and the way that technology is being implemented today, unfortunately, it's made it very difficult for physicians to establish the relationships, the bonds that have classically characterized the profession and that for centuries before had provided what was really at the heart and core the most meaningful aspect of being a physician. And so we find ourselves in the situation today with disturbingly high rates of physician burnout. By a variety of different studies, 50% of physicians practicing in America today are burned out. 50% of our healthcare workforce at the front line, the physician front line, are burned out. And it doesn't stop with physicians. It goes throughout the healthcare workforce. Why is this? Would we have seen that 75 years ago? I don't think so. In fact, the studies are showing that it's getting worse, not getting better. So I want to take just a casual poll here. This may be somewhat generational. But how many, and we've got at least 2 Duke people here, so I expect you to raise your hands. How many of you, during your medical training, at 2 or 3 o'clock in the morning, called security to open up a faculty member's office to find a chart or an x-ray that you needed for the next day because you couldn't find it anyplace else, and you spent 2 or 3 hours tracking things down in the middle of the night? How many people have done that, okay? Right. Rarely happens anymore, right? Because now we have electronic medical records and we have electronic systems for storing radiographic records. I remember when I graduated from medical school and went to Duke as an intern and junior resident, the epiphany then was Duke had just installed an electronic system for delivering lab results. You know, I was a medical student, you got the little slips and they went through the pneumatic tube and the pneumatic tube got stuck, so you had to go figure out how to extract the pneumatic tube. You know, what a great relief it was to be able to look up lab results. It seems trivial today, but imagine at the time. So have electronic health records been terrible and bad? No, they've done a lot of good. But the way they're impacting the relationship between physicians and healthcare providers today is overall very negative. Now, we could get into a long analysis of why that is, and it's not just the structure of the electronic health record. A lot of it has to do with the compliance requirements for billings and collections. But nonetheless, there's a fundamental problem today with the electronic health record not delivering what it should be delivering. Another example, Abraham mentioned that earlier in my career, I described a clinical syndrome, an inner ear disorder. It has some characteristic symptoms that you can type into a Google search, for example. So if you type words like noise, dizziness, noise, hearing sounds too loudly, just any number of different keywords, you'll get within the first page several different websites that describe this syndrome. You type those same words into the chief complaint line of the electronic medical record systems in common use today, and you as a physician or other healthcare provider get absolutely no assistance in making a diagnosis. Now that's not right, right? I mean, if Google can do it, then why can't an electronic health record come up with something that actually helps us practice medicine? So this is a big area of emphasis for us. We're pleased to have several partnerships that are impacting that. Feifei is going to speak to you in a moment. We're pleased to be collaborating with Google Scribe, where we have Google engineers embedded within one of our family medicine clinics, using Scribe to prepare clinic notes rather than, right now, physicians still have to type the notes, as they have been for a long time. But hopefully with the wonders of AI and machine learning, we'll be able to get a system that records an interaction between a provider and a patient and provides a documented record rather than having a physician or a paid scribe do that as an intermediary. And there's so many other things we can bring to bear as well. So this topic of AI and humanism in medicine is truly a timely topic. We want to be a leader and certainly in all areas related to biomedicine, but in particular at transforming the future of electronic health records. So on June the 4th, in this room, we'll be sponsoring a national symposium on the electronic health record. We have leaders from the dominant EHR companies here. We have representatives from CMS, HHS, as well as a lot of other thought leaders in this space. We can, we should, we must do a better job of creating a documentation system that not only meets the appropriate needs for compliance and billing, but also helps us deliver care, enables us to, doesn't impede us from the relationship that we as providers need and want to develop with our patients, but rather helps us and enables us to develop those relationships. Now, all of this is groundwork for our overall initiative in Stanford Medicine in precision health. For years, we've been very focused on the delivery of medical care. It's this past 75 years that has been nothing short of a renaissance in medicine. And we today have so many better methods of treating severe acute diseases. And certainly if we walk into our hospitals today, we see those methods being deployed to help the patients who entrust their care to us. And the enablers we have in the treatment of those diseases continue to grow more and more powerful. Enablers like genomics, data science, regenerative medicine. All of these are being applied to the treatment of cancer, heart disease, and increasingly to debilitating neurological diseases. But wouldn't it be wonderful, and shouldn't we, be applying those same enablers to predicting and preventing disease? And that's the goal of precision health, as Bob Harrington has described, to predict, prevent, and cure precisely. But really in that order. Because if we do a better job, and when we do a better job of predicting and preventing, we won't have the same degree of need for the ultra-specialized curative approaches. And isn't that what we'd all prefer? Wouldn't we prefer to stay healthy or to diagnose disease much earlier so it can be treated in a less invasive, less consequential way? Wouldn't we prefer to do that rather than need the ultra-specialized care that we and other academic medical centers are so appropriately known for today? At the heart and core of precision health is putting the patient in the center of everything we do in healthcare, putting the patient back to where the patient should be. Viewing the patient and enabling the patient to be involved in the most critical healthcare decisions, and enabling the physicians and other providers to return to what drove the vast majority of us to go into medicine in the first place, and that is to be able to interact with people, to add value to the lives of people at the most critical points in their lives. And to do that, we need to enable prediction and prevention. We need to build electronic health record systems that are not a burden, that are an asset in the delivery of care. And we need to get back to the values and priorities that classically have characterized the medical profession. I think with Abraham's leadership, the great work of the colleagues that are working with Abraham on presence, I know that's within our grasp. And as in so many other areas, this is going to be an area where Stanford takes the lead. Others expect that from us. And thanks to the great work that Abraham, colleagues, all of you in this room are going to do, I know that 5 years from now, when we come back together, we're going to be able to cite a lot of advances that have come about because of the things we're talking about today and the hard work we're all going to do in the intervening interval. Thank you all for being here today. Enjoy the conference and keep up the great work.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.